The following videos demonstrate how to operationalize patient-centered counseling about reproductive goals and contraceptive preferences using the PATH framework. This framework is a concrete set of open-ended questions and counseling skills designed to effectively engage with patients about their reproductive goals and, when appropriate, pre-pregnancy care, contraception, and infertility services. PATH is an acronym. The PA stands for parenting or pregnancy attitudes, the T for timing, and the H for how important it is to prevent pregnancy. PATH asks the following 3 questions. For the PA, do you think you might like to have children at some point? Or if the person's already had children, do you think you might like to have more children at some point? The T, when do you think that might be? And the H, how important is it to you to prevent pregnancy until then? So yeah, we'll do all that testing.
Okay.
And we'll see how it goes.
Sounds good.
Patty introduces a transition to PATH once a bit of rapport is built by addressing one of Jackie's reasons for coming in.
So, do you think you might like to have children at some point?
I'm really not sure. Probably. I used to think no way, because I've just about been raising my little brothers. But my sister has the cutest baby I've ever seen. So, yeah, probably.
Patty skips the T in PATH, which is the timing-based question, when do you think that might be? This is because Jackie is 17 and gives no indication that she would like to have a child anytime soon. A provider may choose to omit the T in teens who have not expressed a desire for pregnancy.
So how important is it to you to prevent pregnancy?
Really important. My mother would kill me.
Patty paraphrases and then offers a discussion about contraception rather than making any recommendations yet. Notice the many other examples of paraphrasing throughout the vignette.
And you've said you've been hooking up with Michael, which is why you were here for testing. And I'm just wondering, would now be a good time to talk about contraception?
Yeah, that's part of the other reason why I'm here.
The visual aid was in the room, so Jackie had time to look at it before the visit and then could refer to it during the visit.
While I was waiting, I was looking at this chart. I totally did not know that some types of birth control work really good and others look like a waste of my time.
Yeah.
Jackie has already mentioned something that's important to her about her birth control. So instead of beginning with, do you have a sense of what's important to you about your birth control? Patty paraphrases what Jackie has already said. It sounds like one of the things that is important to you about your birth control is that it's very effective at keeping you from getting pregnant. And then adds, do you have a sense of what else? Patty uses plain language rather than saying highly effective or high efficacy.
Well, it sounds like one of the things that you're interested in with birth control is that it's really effective at keeping you from getting pregnant until you're ready. Do you have a sense of what else might be important to you about birth control?
I'd really like something that I don't have to think much about because I've got so much going on with school and I have to watch my brothers. And honestly, I'm not that good at remembering stuff.
Patty gives validation. Notice the many other times in this vignette when Patty validates or points out something positive before giving Jackie information.
Welcome to the human race. Nobody's that good at remembering to take, for example, a pill every day. So it sounds like you're looking for something that's really effective and that you can forget about. Do I have that right?
Yeah, that sounds right.
So do you have a sense of what else you might be looking for?
Since Jackie has already said 2 things that are important to her, Patty gives examples of method characteristics. It is best to decide which examples to give based on the particular patient. In this case, Patty could have said, for example, some methods of birth control are easy to hide.
For example, some methods can help with things like painful periods or acne. Some methods even help prevent cancer.
I do get super bad cramps when I get my period. Can birth control actually help me with that?
Absolutely, yeah. And some of the methods at the top of this chart can help prevent cramps with your periods. And actually, many people who use them don't get their period at all, or maybe they just get occasional light bleeding or spotting. How would it be for you if you didn't get your period while you were using one of these methods?
I didn't even think that was possible. My abuela told me that it's not healthy not to get my period, so I don't think that's for me.
Patty responds first with strong positive agreement before moving on to clarify about amenorrhea while on hormonal contraception. Note the plain language and the use of a visual aid.
Your grandmother's completely right.
My abuela is awesome. We're really tight. I tell her everything.
Well, when you're not using birth control that has hormones in it, it is important for you to get your period regularly.
But what if my birth control does have hormones in it?
That's a great question. And interestingly, so this is a uterus. This is where, if you ever do decide to have a baby, the baby will grow right in here. Mm-hmm. And this is the lining of the uterus right here. So when you use a method of birth control that has hormones in it, it makes this lining super thin. And there's nothing healthier for a uterine lining than to be thin. It actually helps to prevent cancer.
Immediately after explaining the science in plain words, Patty asks a follow-up question which helps Jackie integrate the information.
So knowing that, how would it be for you if you didn't get your period while you were using one of those methods?
I think that would be pretty awesome. I really hate my period.
So do you have a sense of what else you might be looking for with birth control?
That's all I can think of.
Patty pauses to give Jackie a moment to collect her thoughts, since Jackie appears to be considering the question and looking at the visual aid.
My sister has one of those IUDs. They gave it to her right after she had her little baby. She likes it. I might think about that, but it kind of freaks me out.
Patty asks, "Can you tell me more about what freaks you out?" rather than reassuring prematurely before she knows what is concerning to Jackie. Also, Patty doesn't ask why, as that can be perceived as challenging or indicating that Jackie shouldn't be freaked out. Next, Patty responds with empathy before going on to clarify the information about pain.
Can you tell me a little bit about what freaks you out?
Yeah, my friend said she heard it hurts a lot.
I can see why that would freak you out.
Patty uses a tactile aid. Then, while Jackie holds the device, Patty uses a visual aid to give the needed information using plain language. She then asks a follow-up question. Notice the use of tactile aids later in the vignette.
So this is what an IUD looks like and feels like. This is not a real IUD, but it looks exactly like one. And the place that it goes is up here in the uterus that we were talking about before. And I would place it into your uterus. And your friend's right, it can cause some cramping and some discomfort. It's kind of like a bad menstrual cramp or bad menstrual cramps. But once it's in and it's in place, you shouldn't have any pain. Does your sister have pain?
No, she never said she did. It's so small and soft. How can something like this keep me from getting pregnant?
I hear that all the time. It actually blocks the sperm from getting into the uterus. The sperm is the stuff in the man's semen that can get you pregnant.
As Patty says, sperm never meets an egg. She uses visual cues with hand gestures to help Jackie take in the information.
So the sperm never meets an egg. So how would you be with all that?
Well, I do have a ton of experience with cramps, so I'd probably be okay. Does this one go up there also?
Patty does not say no, yet replies to Jackie's question.
So that's an implant, and it goes right under the surface of your skin, right here on the inside of your arm. And this is what it feels like. And Sienna, the woman that brought you back, she's actually using an implant, and she loves to show it to people. So if you're interested, I'm sure she would show it to you.
Yeah, that sounds quite interesting.
Also, you said that you're really interested in something that's in the very top tier of effectiveness. And this method, this implant, is actually the most effective method we have.
Rather than percentages, Patty uses plain language, which is whole numbers and natural frequencies, such as a given number out of 1,000, and a common denominator.
If 1,000 women used it for a year, probably none of them would get pregnant, or maybe one. As compared to, for example, the pill. If 1,000 women used the pill for a year, 70 or 80 of them would be pregnant at the end of the year.
I never heard of this before.
Would you like to hear more about the implant? So most people using it don't get their period at all, or they just have occasional light bleeding or spotting. And you said before that you'd be okay with that. Is that right?
Yes.
Okay. The thing is, we won't be able to predict what your bleeding is going to be like. So most people have not very much bleeding, but we wouldn't know whether or not you were going to bleed or spot.
Again, Patty asks a follow-up question before proceeding to give more information. And Patty doesn't suggest the mini pad. She lets Jackie come up with a solution herself. Notice the next 2 follow-up questions and Jackie again coming up with a management solution. Jackie will integrate the information best if she came up with it herself.
So how would it be for you if you couldn't actually predict?
Wouldn't love that, but I guess I could keep a mini pad handy.
That's a great idea. About 1 in 4 or 1 in 5 women who are using this may have some periods of time where their bleeding is really going on for a long time. It can be really annoying. Have you ever had bleeding that went on for a long time and was annoying?
Yeah, about 6 months after I started getting my period, I bled and bled.
Do you remember how you managed it?
Yeah, they gave me birth control pills and it went away.
That's great you know that, because that's a treatment that we can use if, while you're using the implant, you have bleeding that's annoying to you.